7, 8, 9, 10.
All right, perfect. Thank you so much.
Sure,
Once again, thank you for your patience. I know we were
sure,
trying different ways to do this, but and thank you for taking the time to
sure.
even do this because we really wanted to make sure our viewers understand everything with the coronavirus because they're seeing it everywhere. And as much as I like social media, what I don't like about social media is that people like to share things that aren't always necessarily true.
Correct.
So that's what we're trying to do here is just to make sure that people understand what's going
Okay.
on. So we'll get started. I don't know why these things keep popping up, but if you can just start with your first and last name and spell it for me.
Sure. My name is Dr. Frank, Frank Welch, Welch.
Okay. And give me your position if you don't mind.
Sure. I am the medical director for community preparedness for the state of Louisiana.
Okay. So we're talking about coronavirus here, and what can you tell us about if the state has a plan at this moment? What that plan is, if there is one?
Absolutely. So we actually have been planning for this kind of thing for about 20 years now. The basis has always been pandemic influenza. And if you take out the word influenza there, you kind of realize it's a severe respiratory illness. Well, that's exactly what COVID-19 is. And 99.9% of the exact same principles that would apply to an influenza pandemic apply to COVID-19. So fortunately, we, the state of Louisiana, along with lots of our healthcare partners, our business partners, have been planning for just exactly this for about 20 years. And then remember, we exercised it back in 2009 with the H1N1 epidemic. Mm-hmm. So we have been planning. We do have a plan. That plan fits for COVID-19. And right now we're in the preparation stage, which has us getting ready for COVID-19.
Mm-hmm. And can you share what that plan is?
Sure, absolutely. It's a multi-part plan, again, working with our partners, but first to detect whether COVID-19 comes to both the United States and Louisiana, to try and contain those first cases so that it doesn't spread. When it starts to spread, to make sure we have laboratory testing so we know who has it and who doesn't have it, to prepare our healthcare community to make sure they can receive patients who might have this, the more serious cases, and also to do all kinds of other planning, like with our business community, to make sure if they had reduced employees or absenteeism, to work with them to work around how they could perform better if they had reduced employees.
Got it. And I guess with all those things being said, that's the way that you guys are going forward to combat it if it were to be in Louisiana.
That's exactly right. What we've been told to prepare for is it's probably going to spread in the United States just as it's spreading in many other places. So we now have to move is sort of like if it's going to come to Louisiana to a more posture of when it comes to Louisiana. And we always plan for the worst case scenario and we hope for the best, but by making sure the public health community, the healthcare community, and also our infrastructure is prepared for something like this is the best way to respond when it does get here.
Gotcha. So what are the areas of concern with the coronavirus?
Well, the biggest concern is it looks like a bad cold, which is what it is. Most people don't realize that about 20% of the common cold that goes around all the time is coronaviruses, not this specific one, but coronaviruses in general. And again, it kind of looks like the flu as well as the common cold. So for the average person, they might not even have any symptoms, or they would have symptoms of a common cold. We wouldn't know whether it was COVID-19 or just the common cold or the flu. So first distinguishing, whether it is COVID-19 or not, and then moving forward, this is a really bad cold that can strike lots of people because most people haven't been exposed to it. So dealing with a lot of sick people at the same time, just like we do in a really bad flu season, that can cause absenteeism at school, it can cause absenteeism at work, and it can be a burden on our healthcare system. So we want to be looking at all of those things and prepare for those things before it gets here.
Yeah, and preparation, of course, is always the key there.
Is key. You are absolutely right. And again, we've been planning for and preparing for 20 years. But sometimes you have to just make sure you have it in the front of your mind. And so that's what we're doing right now. We're in that preparatory stage. We're working with hospitals and businesses to say, if this does get bad, how would you operate? And so we're in that phase right now, and we have been planning for 20 years, but we're getting ready now.
Gotcha. Um, what would you say? Because especially overseas in China, where it was first detected, there are a lot of people walking around with masks, and we've done stories a couple of weeks ago when it really was first getting
Yeah,
some traction, where a lot of pharmacies and stores were sold out of masks.
right.
What would you say is a good mask to use if someone wants to use one, or are there any differences in masks?
Well, the first thing is the Centers for Disease Control does not currently recommend anywhere wear a mask, and there's a reason for that, because they don't protect us as well as we hope they do. Believe it or not, it's kind of the reverse. If someone is sick and they're wearing a mask, that kind of prevents them from spreading it from to other people. But if you are not sick and you're trying to prevent yourself from getting sick, sometimes wearing a mask gives you a false sense of security. So I don't necessarily recommend one mask or another, nor would I discourage anyone who really wanted to wear a mask to wear a mask. I would just tell them that your better protection is actually those kindergarten rules that protect us from any cold and flu, which is wash your hands frequently, cover your cough, make sure you stay away from sick people, and avoid large crowds where people could be sick. Those are your best protection, better than thinking that a mask is going to protect you when it isn't that good at it.
Right. And also one thing and this is something I learned, and maybe it was when the whole H1N1 thing was happening, was I guess the proper term for it is the vampire sneeze, where you.
That is exactly right.
Yeah.
Yeah. And I always tell people, if you are sick, so if COVID, let's take it to the worst case scenario, Dion. Let's say COVID is spreading within Louisiana. The best thing people can do, given that it's really a bad cold for most people, is stay home and stay away from other people. Wash your hands, and that's the way we're going to prevent spread within our communities. And that's the way we prevent spread of flu. We always tell people, if you're sick, stay home, and if you get really sick, call your doctor. That way you'll be hooked into the medical care system. But the way these things spread is when people aren't that sick, and then they continue to do their normal activities, go to school and sports and work and everything like that. That's how things spread. So really those simple kindergarten rules are what we really want to fall back on.
Right, definitely. Kindergarten was good for something.
Yeah.
So when we first started, I told you, about, the whole thing with social media and some things that may not be true spreading, and that, people believing those things.
Right.
So apparently there was something going around that recommended that men with beards shave their beards because it would the hair or something when the follicles or something with the virus. Is that even true, or is that just like something somebody made up?
I think what they're referring to there is if someone had a beard, a face mask wouldn't fit as well.
Okay.
And thinking that maybe there was some correlation there. Again, I wouldn't take it to that extreme. I'd tell the guy with a beard to wash his hands a lot and stay away from sick people.
Mm-hmm. Yeah, simple as that.
Yeah.
Yeah. And hopefully you can clear this one up for me. Apparently there's a test for coronavirus, but we don't have it in the state. Is there a timeline for that to happen, or what's with that?
Absolutely. So there is a test for COVID-19. It was developed at the federal level, and the CDC has it. So first off, in Louisiana, we still have the ability to test any samples we need at the CDC currently, and there is no backlog. So I wouldn't want people to think that since we didn't have it in the state, there's some kind of huge problem. There absolutely isn't. We FedEx those samples immediately to the CDC, and they're tested immediately. About 10 to 12 states currently have the ability to test for COVID, and it's a problem with the test itself. We were sent the test about 2 weeks ago, but the test they sent us was not a good test.
Oh.
And so they're fixing that, and so we expect that we're going to have the ability to test at our state laboratory. They tell us soon, but we do not currently have that capability. But our laboratory, our state laboratory, is ready to take that test, to validate that test, and as soon as we're ready to start testing samples here within the state.
Okay, and where is the state laboratory?
In Baton Rouge.
Okay, all right. I thought so. I just want to make sure
Yep.
I got that. Since I have you here, I want to try to get all my questions out and make sure I have everything
Okay.
clear. Um, so I know this is like the flu, and it could be confused with it, because of the symptoms and everything.
Yeah.
So if someone thinks they have the flu and they go to an ER or an urgent care, but it ends up being the coronavirus, what advice do you guys have for an emergency room or an urgent care for dealing with something like that?
So we have been communicating extensively with the healthcare community within Louisiana. We put out 3 what we call health alerts, and those health alerts go to every hospital, every doctor, many nurses, all urgent cares, even private doctors' offices, giving them guidance about what to do if they suspect they have a patient with, both flu or COVID-19. And part of that guidance gives doctors and hospitals a hotline that's 24 hours a day, 7 days a week. If they suspect a patient has COVID-19, by calling that hotline, they have access to guidance on whether it could or may or may not be a case of COVID-19, an avenue to testing, and then how to treat the patient from there moving forward. So we have a system within Louisiana to evaluate, test, and treat patients if they possibly come down with COVID-19, all linked into every single healthcare provider within Louisiana.
Got it. Luckily, we don't have it in our state.
Currently?
Right, currently. But like you mentioned, it's when it could get here. What would you say if there is an idea of ports of entry here in our state
Right.
where it could be seen first?
Well, that's really hard for me to say, and I wish I did know. But now that we have seen that there is localized spread, not just in China, but places like South Korea, Iran, possibly Italy, possibly other places, an infection like this, once it's that widespread, is really difficult to sort of close your borders and not let people in. For example, I was on a call the other day that said we have about 10,000 visitors almost every day from South Korea to the United States, and it's spreading within South Korea. So I would assume that the way it would get to the United States is by air travel, and probably not from China. Probably because it has gone outside China now, it is probably, and I hope this is not true, but it's probably just a matter of time before it starts to arise in the United States. And as you saw overnight, there is question about a case in California that did not have travel to China, which may represent our first case of person-to-person spread, although they don't know that yet. So again, I hope it doesn't happen, but we've been told to prepare for when it occurs, not just if it occurs.
Right. And with that California, I'm glad you mentioned the California case. Could it be? And I want you to know I respect everything you guys do, because you guys go through so much training and years of school and everything. But could it be possibly? And I know you don't. You're not a doctor on the case,